What do we need to consider when we're thinking about language of intervention?
Well, for monolingual clients, obviously we treat in that language. For bilingual clients, it certainly gets more complicated. It gets more fun to plan intervention, quite frankly. We need to determine what their deficits are in both languages. Sometimes those deficits, those areas of need will be quite similar, if not the same, in both languages. Other times those difficulties will be different. So an experienced bilingual speech-language pathologist will thoroughly analyze the profile of deficit. Sometimes those features that are similar can be treated in one language. The features that are different often need to be treated separately. What I often see is clinicians kind of postponing the bilingual intervention, conducting monolingual intervention, I think because it's easier. And a lot of clinicians are unsure how to plan bilingual intervention. I can't say here's the perfect recipe for how to do it, but again, analysis of those similar features as well as those contrastive features are the next step. Looking for patterns of transfer. What have I treated that is actually transferred to the other language? Careful monitoring, careful progress monitoring is very important. But the question of whether or not to treat both languages, rather the question is not which language to treat, the question now is how do we treat both? Some people have given the analogy of our hands. We use both hands. Having to function with only one hand would be very challenging. Bilinguals are very similar with two languages. They need both languages to function. Having to function in just one language would be very difficult for many and in fact create a handicap essentially if they were only able to function in one. So treatment of both makes sense. Again, strategic planning and progress monitoring are important steps for bilingual intervention.
Well, Dr. Groman, thank you for coming out to talk to us about issues in bilingual speech-language pathology. We really appreciate your time.
My pleasure. You're welcome.